Hi, I'm Reggie Turner. I'm here with Jim Miller and Terrence Moore. The FlipSide starts right now. Welcome to the show. Tonight we are joined by Dr. Doug Spotts, the Vice President and Chief Health Officer of Meritus Health. Welcome to the show.
Great to be here.
And also, Class of 2022, Leadership Maryland.
Absolutely.
Deuce. Good stuff.
Good stuff.
Dr. Spotts, start off by telling us a little bit about your background and what led you to Meritus and
Wonderful.
where you're going from here.
Well, it's hard to believe. It's been a little over 5 years. I came to Meritus in 2018 after most of my clinical practice being up in central Pennsylvania, just about 2 hours up the road. So first and foremost, I'm a family physician by background, and I was in private practice for most of that time. It's 30 years this year, which is hard to believe too. That time just goes quickly. But I came to Meritus because I was attracted to lead population health, and we'll get into a little bit about what that is a little bit later. But really, most of my career has been spent really looking at the downstream effects of poor health and poor health decisions. And so much of my medical training was how do you fix what's broken? And I was intrigued as I've evolved in my career as to how can we go upstream? The saying in population health is, how can you turn off the faucet and quit mopping up the floor? So how can we go upstream and really promote wellness, prevention, try to be our healthiest selves individually and as a community, because that really, that prevention really is so critical. And Maryland was very attractive to me because of what they're doing in that space to get towards what we call value-based care transformation and trying to go upstream, trying to promote prevention and get healthier. But we've got some work ahead. At Meritus, I really had the pleasure when Malik Joshi came as our CEO in 2019 to lead the health work of our quadruple aim, now quintuple aim, bold goals. Health, healthcare joy at work, financial responsibility and stewardship, and our quintuple building the medical school, the Meritus School of Osteopathic Medicine. I lead health, and we chose as our goal losing 1 million community pounds, which we'll hear more about in a little bit. And then that really guides a lot of my work in the community, outside the doors and the ambulatory practices of Meritus, leading quality and safety with a really great Vice President of Physician Services team member, and founded the Meritus Family Medicine Residency Program in 2019 as well as a community solution, which really led us on our way of promoting graduate medical education, was an early seed to the great work that Dr. Joshi, Dave Lair, and others have brought about in forming our School of Medicine, Dr. Gregory, Dr. George, Dr. Miller. So I get to work with an incredible team and absolutely all focused on creating a healthier community. That is our mission. To create the health of the community, to promote the health of the community, to make it the best possible. And that is something that motivates me every day.
Excellent. Now, Terrence, I believe you're on the steering committee of Go for Bold.
I am.
So I will toss it to you, sir.
I am on the steering committee, but it's been a pleasure to work with you in so many different avenues, since we've gotten to know each other in the community, from the Maryland Symphony Orchestra to the Commission on Aging. So you are on the forefront in the community and really touching upon how health really drives our community as a whole. And I had the pleasure of joining Go for Bold about 2 years ago now, I believe, that I kind of got on board with that. But it kind of started right before the pandemic. And we know how important healthcare has become, as becoming more aware of it after the pandemic. But you look at the timing and some of the dates that you mentioned, Meritus was right there. Like, it was right ahead of the curve as so many other communities right now turn inward and try to look for ways to do exactly what you're doing right now. Some momentum slowed down because of the pandemic, but It's a lot of hard work that's kind of propelling this community forward, and we're doing it through health. Now, I'm not going to steal a thunder what Go for Bold is, but I just wanted to thank you for what you do in the community, and truly appreciate that you are on the front line. And it's good. It's one thing to say it from the comforts of your office. It's another thing to say it day to day in the community and helping and supporting organizations. And this initiative also is very dependent on our business community as a support metric as well. So I'll turn to you and let you kind of give us some more background on Go for Bold, and then we can talk more on that.
Wonderful. Thank you so much for those kind words. It is great and exciting to be out in the community and to do this work together. And I really want to emphasize together, because this is not just Meritus. This is the health department. It's our local health improvement coalition, the LHIC, which is a unique structure in Maryland. And it's that partnership that really started before we chose our bold goal in healthy Washington County. So that existed and has many members. I think it's over 90 members now and growing all the time, coming together to promote the health and wellness and well-being of our community. It's a great community, and I think we sometimes don't emphasize enough all of the good and the positive things that are going on. And that's what's so exciting about doing this work. So you're right, boy, it seems a long time ago, but just in January of 2020, what was exciting about leading this work was bringing the community together. We were the convener, maybe the catalyst at Meritus, but we brought the community together, and we had about 25 partners come together and join us in Robinwood 142, the large conference room, the auditorium. And that was a blip on the radar, the pandemic at that time. And we said, we need to hear from the community. Look at the community health needs assessment that fellow leader Alan Twigg runs with the community health team every 3 years rather. And we looked at obesity, diabetes, addiction, mental health, all within a percentage point of each other at the top, and all have been at the top every 3 years for at least 3 to 4 cycles, maybe longer.
At the top of what?
At the top of the list of the major concerns for health in the county. Those results leave some pretty staggering statistics that COVID didn't help. But what we did, we looked at the model when Oklahoma City in 2007 was named one of the most unhealthy cities in the nation. The governor, or mayor rather at the time, Mick Cornett, got the city council together and said, we are all in to not be the most unhealthy city. And we just had him at our community celebration last October, and those who attended, Terrence was there, heard a tremendous inspirational talk about how he was all in, and in 5 years, the population of Oklahoma City, about 40% engagement of 250,000 individuals, came together and lost 1 million community pounds together over that 5-year period. That inspired our community stakeholders to choose that as our Health Bold goal, because we really wanted to get ahead and tackle what I just mentioned, the higher rate of diabetes, pre-diabetes, addiction, behavioral health issues like depression and anxiety that all drive and perpetuate that cycle that's unhealthy. And picked that because they said, hey, Oklahoma City did that in 5 years. We can do this. We'll give ourselves a 10-year goal because it aligns with Healthy People 2030, which is a national effort. And we had just come out of the Healthy People 2020 movement. And bringing that group together was business leaders, it was government, and everybody said we can go bold with this goal. And that term bold was first thrown around there. Go for bold sort of came about as a play on the delayed Summer Olympics, so Go for Gold, and the committee, which has community stakeholders like Terrence on it, came up with a theme: Go for Bold, do, eat, and believe in a healthy Washington County to tackle some of these issues. We are not quite in last place out of the 24 counties in Maryland, but we're next to last. And that statistic got worse during COVID in terms of being more obese, more diabetic, more pre-diabetic, and all of this, how we can sort of really drive and promote health is not predicated on shaming about weight or other uncomfortable issues. It's predicated on if everyone in this county were 3 to 5 pounds closer to their ideal body weight, we could knock this out of the park before 10 years is up.
Wow. So we have 150,000 residents, plus or minus, in Washington County.
Yeah.
What is your goal in terms of participation?
So we'd love to get that same level of engagement or more that Mayor Mick Cornett did in Oklahoma City. So they had 40 to 42% engagement. We'd love to get even 50% engagement. And we'd even say that, you know, it counts for all of those who work, play, pray, live in Washington County. So we know that in the surrounding, you know, tri-state area, we have people that drive into work or come here to worship or come here to use the great recreational opportunities. So if we could engage, you know, 40% or more of those people, that would be about 40,000 individuals. And as of today, we have 5,100 registrants. The only way we're going to continue to lose those pounds and, you know, get that 3 to 5 pounds per person closer to our ideal body weight is to engage more people, because it can't be on the backs of the committed 5,100 to do all the work to get to 1 million pounds. We didn't divide it coming out of the pandemic, you know, into year by year lose 100,000 pounds. We are definitely seeing that momentum pick up, and we're over 75,000 pounds, which feels really great, and we should celebrate that. But we know we need to get more and more engagement.
Yeah, and the goal is really 100%, right? Is that from a steering committee, it would be great if everyone can be included, because everyone can participate in some way or another. And, you know, and it's not just about people who need to lose weight.
Absolutely.
It's also about maintaining your weight, maintaining a healthy weight as well, and just registering those pounds and kind of saying, I'm in, right? It's kind of, you're kind of throwing your hat into this, I'm in for what we can do as a healthier community. And, you know, any kind of thing you put forward, you need metrics and measurements. And Go for Bold is not just about weight loss, it's also just a ultimate healthy lifestyle. It's about building strong relationships and emotional health and mental health and tying that together as well. So talk more to the umbrella that this really covers from Go for Bold.
Yeah, I alluded to it when we talked about do, eat, and believe. The very first thing we said at Meritus as the largest employer in the county was, we're going all in. And so we said, you know, we're going to take out some of the sugar added beverages and higher, you know, calorie foods that may not have been the healthiest choices. And it started a transformation with our dietary team to have sort of featured healthy choices of the month and all sorts of initiatives, to your point, to reach everyone. So whether you're visiting the hospital, whether you're coming in, whether you're one of our employees, we really want to invest in the health of our employees. And so we've said, hey, if you're, you know, participating in our health plan and our health benefits, as long as you go, you know, quarterly or twice in a 6-month period into the registration of the weight tracker and just your personal accountability tool for maintaining that ideal body weight, will, you know, incentivize you and take a dollar amount off your premium each pay. And so we were really all in, because we just really felt that we had to lead the way. But we've had such great examples in the community of how this is accessible to all others, as your point, to your point, Terrence. We have included this year, the Healthy Washington County Business Challenge has come back from COVID. And so I would say, if you're not involved as a business person, small or large, you should get involved in that. It's not too late. It runs all the way through the end of June. And a goal of that is to have 50% of your employees register for the Go for Bold campaign as a part of that, to get your points and your certificate and some of the extra sort of incentives, you know, to do that. We'd love to have, to your point, every business in Washington County, small or large, be involved in that, and we really could use that support, you know, from the business community. We've had lots of other examples of how, to your point, of this, the do, eat, and believe part. Do an activity from wherever you first are at your activity level. So if you aren't doing much physical activity at all, maybe get up from your desk and just do some walking around your office or around the hallway during the day. Maybe park a little further away when you go to the store and just try to take those extra steps. meeting you at all levels. If you're chair bound or wheelchair bound or bed bound, it could be doing some arm exercises. There are great examples when you go to the website under these categories of what you can do to take that one small step for change to become a healthier you. Eat, making that healthy food choice, and then finally believe some of the mental health resources for mindfulness, meditative practice, where to reach out if you are having stress, anxiety, depression, how you can get free resources. Matter of fact, all of these are free resources. There's no cost to participate in this.
I was going to ask, and I think you've at least partially answered it, but aside from the, as you call it, personal accountability tracker, what are some of the examples of resources?
Yeah, so there'd be examples from our different partners in this, and it costs nothing to be a business partner of this. You get your logo, your high resolution logo displayed on the website, but there'll be different services offered in the community. I would say there have been for years many good organizations, people doing good things in the community, but this is sort of a community platform to magnify what's going on. So, for instance, I'll pick on a business, Hub Labels, Thomas and Elise DeBura. They have done just such a great job of treating their employees like their own family members, and they've talked about what it's meant to their business to have healthier employees. So they have over 60%, it's growing every day, of their employees registered for this. And then they've entered them in sort of fun prize giveaways. I think there's a cash prize that they've done. So very small things, an investment, but they've really incented their employees to be a part of this. We've talked recently to Kathy Powderly with Hark, and we're going to co-promote the Hark Hike coming up on June 10th, so that we have an ability to try to bring together lots of individuals to get out and do a hike to the best of their ability.
Excellent. Doug, we're going to hold it there. But just for our viewers, it is healthywashingtoncounty.com, which is the website that everyone can go to find more information, correct?
Correct.
Absolutely.
And we do have a QR code that should be showing on our screen.
Excellent.
As we talk.
And it should take you right there.
All right. Stay with us. We'll have more with Dr. Doug Spots from Meritus Health after the break. Welcome back to the show. We're still here with Dr. Doug Spots of Meritus Health. Doug, thank you for staying with us. Jim, jump right in, sir.
So I guess personally, I started on a journey like this a year and a half ago. Now, I still have a long way to go, but I didn't get this way in a day, so I'm not going to get out of it in a day, which I think is one of the things that I've learned very quickly. When I started, the first thing I did was to go see my doctor, who's a Meritus doctor, by the way, and say, hey, I hired a personal trainer. What do you think? Good idea, bad idea? Well, good idea, but she made sure that, there was nothing that would preclude me from doing certain things, and she gave me some advice. And it's worked out very well. If people are looking to get into this as a brand new lifestyle change, what should they do? What should they expect? How should they proceed?
Well, first of all, take that first step. I think that sounds so easy, yet that's so difficult for most of us. And so it's great, that you had that connection. And I would always say, as a family doctor, come talk to your medical team, because they want to do an assessment and make sure that they can give you some guidance as to what you can do. But if you're not connected, we have lots of ways to get you connected. And if you can't come to us, we'll come to you. Our mobile clinic team has pivoted from the great job they've done with vaccinations, and they've shown up at all sorts of community events, whether it's the Summer Basketball League in Wheaton Park, whether it's going to the various health fairs that are in the city and the county, just coming out to lots of places. We're up in Cascade at the community center in Cascade. We'll come to you and reach out for help, and we can connect you. If you have the ability and means to have a trainer, it's a great way, because we all need that motivator, that coach, that person to keep us accountable. I think that that's so important. But you know what? There are great examples in the community. Bernadette Wagner and Prime Time for Women. We all know Bernadette. and that incredible group, they have partnered with Walking to Wellness Wednesdays. They walk in the comfort on the nice track at the Arc over at Hagerstown Community College, one of our partners, and they provide that free of charge to the community. And there's a committed group of 30 to 40 individuals that get together every Wednesday and walk. It was going to be a small sort of pivot for maybe 11, 12 weeks. And I think if you talk to her now, we're over 55 and counting. Often there's a speaker that talks for about 5 minutes at the beginning about a health-related topic, and then you walk at your pace with those who are at your pace, and you're not doing it alone. So I think those are great examples to have that accountability factor.
Yeah, I noticed in the gym there are several teams of 2 or 3 that work out together, which I thought was really great as well.
Yeah.
So yeah, that having that extra person that if you're working out at 6 o'clock in the morning, you know you got to show up because your buddy's going to be there, is not a bad thing.
That's a great thing for all of us. Other great resources in the community. Terrence is on our community steering committee, but it's co-chaired by Maria Rubling, CEO at the YMCA. The Y has been a great partner, of course, early on with their HEAL work. Dr. Mitesh Kothari has been involved as well. With that, Maria will always work with people to provide access. She's been instrumental in calling all the other gym owners and fitness trainers in the community to get together. Tina Fraley and Powerhouse Studios, she has partnered with the library, the free library system of Washington County, and so not just downtown at the library, but at the remote sites and the more rural sites. Tina's team is providing trainers to show up there. And so that's another place that you can go. Again, all ability levels are welcome, and it's just taking that first step to being more active.
Well, and I was surprised in my training experience because, you see these trainers in these gyms and they're, doing stuff that I would never have contemplated doing at that point. And I was surprised, and apparently this is what normally happens when you talk to a professional. They meet you where you are. And I think that's very important.
Yes.
The first day I went to see her, what we did was she said, okay, sit down and get out of the chair 10 times. Okay, touch your toes. Okay, show me what she was measuring mobility. She was measuring and get on the treadmill. Let's get you out, start you out at 3 miles an hour, see what that looks like. It was humbling. It was a little scary, but it was also very safe.
Yes.
If that makes sense.
Yes. And really, all of these resources under Do, Eat, and Believe are all there to meet different levels of ability and to make people feel safe and accessible to all.
And when you say safe, it's not just safe physically, but there's an emotional safety that comes with that too, right?
That is 80% of it, frankly. It's not. It's 20% physical. It's 80% about, okay, this is going to be okay. Because let's face it, the first time we do anything, it stinks, right? That's just the nature of life. Whether you're writing your first book report as a high school student or you're getting back into fitness after, having 20 years of an unused gym membership.
Right.
Yeah.
Terrence, a lot in the midst of COVID, when we were engaging with Dr. Spots and others, we talked about healthcare disparities in regards to different communities, African-American community in regards to building trust. And I just remember one of the things that you had mentioned in regards to Meritus being in the community, that it needed to be a long-term partnership to build trust in the community. And Dr. Spots, I remember you jumped in right away. You wanted to be a part of the Ruth Ann Monroe Basketball League. Since then, the mobile clinic has been up in the Robert W. Johnson Community Center, being a part of their mobile drops. Can you, between the two of you, Terrence, because I know that you were a big proponent of that, can you speak towards how you felt about that and how they've executed? And then Dr. Spots, if you can follow up with that.
Sure.
Personally, it was a need, right? And we seen that as we looked at the numbers coming out of COVID. I think we all kind of were aware of it, but we seen what those numbers truly look like in communities of color. A lot of people, a lot of organizations talk the talk, especially around that time. It was the best time to raise your hand and make a statement and say what you were going to do and what you were going to pledge to do. And few organizations or few, especially medical facilities said, roll up their sleeves and say, what can we do right now? How can we partner right now? How can we build relationships? And also take some accountability of the perception of healthcare in those communities that saying was perpetrated through your organization, Meritus, but existed just as a whole nationwide of things that we've dealt with in those communities for decades prior and generations prior, and going in and saying, you know what, we're going to be the face of your fear, but also be the face of your friend for the future. So I commend you on that, and you doing it personally as well, and showing up and being present. But again, it's easy to do that in the moment, but it's hard to do that when the cameras go off and the attention shifts somewhere else, but still be boots on the ground and do that in our communities holistically. Not just in the Jonathan Street community, but in communities where income is lower than the mean of the entire community as a whole. So I thank you for that, and talk to what that looks like long term for you possibly.
Oh, thanks so much for those very kind words. Well, first of all, I'm privileged to work with an incredible senior team and incredible colleagues, and physicians and physician assistants and nurse practitioners and nursing team at Meritus, that I think has served this community well for well over 100 years in the walls, and I think have made sincere attempts to be outside the walls. But I think that the current team under Dr. Joshi's leadership is very committed to the long-term presence of being outside the walls. And as a matter of fact, that's the only way that we're really going to overcome those disparities, by being present, by listening, by being humble, by being servant leaders, by saying, what are the needs? What are the barriers? How can we correct that? How can we change it? I think it's going to be really the silver lining gift that came out of COVID. We knew the disparities existed in this community and in every community in this great nation and in this great state before COVID. But COVID ripped that Band-Aid off, even more so. And so, doing a joint venture with Horizon Goodwill and having a clinic on Prospect Street in a fresh foods grocery store where we also have services for those who maybe can't get to us. We can say that we're on the bus line, but it may take a whole half day's journey to get out there. And if you're working 2 or 3 jobs to try to make ends meet, and you can't get out there. So how can we get to you? I already mentioned the mobile clinic team, and that's not just for the city and addressing disparities in the city, but it's in the county as well. So I've had the privilege of practicing with some of the folks up in Cascade, as well as the folks that come into us at the residency clinic. Our resident physicians having the graduate medical education presence, not just with the family medicine residency, which is our start, but building a medical school to train the physicians of the future and to come here to see the incredible goodness of this community and want to come back here to continue their residency training or come back to practice is definitely a long-term solution. And then we publish a health equity report at Meritus now regularly that transparently is available and says, just like the community health needs assessment on all of these sources, our website, on the website of the Healthy Washington County Coalition, the health department, here's our disparities, here's what we're doing about them. Malik Joshi is inspirational in leading us to say, you're not making a difference if you don't set a measure and a goal and a metric to overcome these disparities, just like we are with registrants and pounds lost.
You've talked a lot about being outside of the walls and bringing these services to the people that need them, either in the context of at a business or at a location or whatever the case may be. From a privacy perspective, you've just asked us all to log onto your website and start logging in personal information. How is that protected? What confidence can you give our viewers that their health information will remain private?
It's a great point. It's one of the things that we have when you pull up the resources, the sort of frequently asked questions. So it just is predicated on needing an email address, whether it's your regular home email or you create a Gmail account, and no one sees this information. So what this is a very simple tool that our IT team built that could be shared, through a secure URL across the platform and go into the Healthy Washington County website. It has all the security layers built into it so that people can't hack into your personal accounts and back into the hospital. There is no personal health information shared with this. When you log in the first time, you put your highest weight that you've been in recent times. Many people go back to like the highest weight they were in 2020 or pre-pandemic. And then the next time you log in, whether it's a day later, a week later, or a month later, however you want to set that up for your accountability, you record what your current weight is today. And guess what? If you lost a pound, great. That gets collected to the community goal of just showing what we're doing together. You know what? If it's over the holidays and you lost 5 prior to the holidays and you gained 5 back, it doesn't take away from the community effort. Anytime you log in, and I know a lot of people who are going in weekly because they just like, again, that accountability factor, or every other week. It's just you seeing your tabulation of those results. The only thing that it calculates on the back end, and it doesn't identify your name, it just calculates what the community has lost in aggregate. So it doesn't go up and down like this. It's just showing what we're doing together because it's an honor system. It really is an honor system when it comes down to it.
So no one shows up to your door and with a scale that said,
No.
You've been off by 1 pound, right?
Right. But I have noticed around functions in town, and especially when I'm with these two guys, they look at what's on my plate, and they sort of look like, yesterday was National Pie Day, right? So they're like, can I have my piece of pie? What's Dr. Spots eating today? No. This is, everybody needs their treats. Everybody needs their reward food. Everybody has a good time being together. It's communal to break bread together, to eat together. But it's great to be able to say, you know what, I'm gonna make this healthier choice, and maybe not carb up as much because my personal journey, I was probably 25 pounds heavier even before COVID, and so it's just something that I thought I'm leading this. I need to set the example not only as a physician but certainly as chief health officer. So I'm on my own journey. I'd like to lose another 10 to 15 myself.
And it's living life, right? Because
sure.
Turner and I, we joke with each other where we call it tuxedo season. That's a reminder. All right, let's get it together now. We know too many buffalo wings, cigars, and bourbon. Let's reel it in now because it's time to make sure that we can still fit in our tuxedos. And we go from piles of nachos on our plate to salads when we go out to eat, and we hold each other accountable for that. If he orders a salad, I order a salad. If he's splurging, I may splurge along with him as well. And Jim has treated us to some great dinners as well. But it's okay for us to sit around and fellowship over a good meal and not feel guilty about it.
Everything in moderation.
Everything in moderation.
And what I've learned to do is I plan around those meals. So if I'm going to have a really heavy dinner, I may have a really light lunch, or maybe just a light breakfast to no lunch. So I think that's the other key. So this really is not meant in any way to replace, like I use MyFitnessPal and I use Fitbit and I use
Absolutely.
Fastic and some of these other apps that are health related, and they all kind of tie in with my little devices and so forth.
Yeah.
This is more about really just achieving something as a community, and again, for some it may be their only personal accountability platform.
Absolutely.
But it can be just an add-on that, by the way, when I signed up, and I did sign up just the other day.
Thank you very much.
And it took me all of 3 minutes.
Yeah.
And I haven't gone in and done my weekly check-in, which I probably will do weekly. But I imagine that takes all of 20 seconds, 30 seconds?
Yeah. Absolutely, and I would love it in a future iteration if all those devices we wear and our phones and everything all synced together and gave credit to Healthy Washington County of what we're doing together as a community, because we should be shouting that from the rooftops of the great things going on in this community, not talking about what's wrong in the community. Yeah, we're not going to put our heads in the sand and not continue to address all these issues, but let's concentrate that we've lost over 75,000 pounds together in the midst of a pandemic starting in 2020. And coming out of that, we should be the flywheel effect, all of us in this county, all of us in our circles of influence, in our businesses, our clubs, our organizations. This should be a cry to urgency to say, wow, what if everybody were 3 to 5 pounds closer to their ideal body weight, taking those steps for health? This is what it did for Oklahoma City. It brought economic development to the downtown. It took, when you heard Mick Cornett last October at our community celebration, it took a city that was easier to navigate by car with 5-lane highways and created beautification projects where you had trees and flowers and plants and a bike and walking trail that was in the middle of those 5 lanes of concrete, and got people walking, got people wanting to live downtown again. We've got lots of great initiatives with the arts and with sports. Wow, could we envision bringing that all together? Could we envision a safe way to cross the dual highway? To connect our beautiful city parks, to connect Fairgrounds to City Park, to Black Rock. I mean, a rail trail. This is what has happened in other communities that have embarked on this, not just Oklahoma City. That gives me great hope, and that's what makes it accessible to everybody in all aspects of the city.
Since you started responding, I went in to track my weight for the day. Unfortunately, I forgot my password, so I went to my email and clicked on a link, got in, put my weight in that quickly.
Yeah.
Right? It took a couple of seconds. It got done. And you can get email reminders as well. An email reminder, you never have to put your password in again. You just click on it, time to enter my weight, enter, and type in 3 digits. For me, maybe higher 3 digits, but hit enter. And it's kind of a pledge, going back to saying, I pledge to be a part of this change. And as you pointed out, the economic benefits that comes downstream from a healthy community can be realized as well.
Absolutely.
Well, and it can absolutely be realized in the business community. I can tell you for sure. And when I started my journey, the other thing that I did with my trainer is I hired her for my company to say, twice a month, I want you to come in and I want you to talk to the people about how they can stretch or work out from their desk, because we have a very, we all work from home. We have meetings back to back from 8 in the morning until 5 in the afternoon. Maybe there's a break for lunch. More often than not, no. How do we deal with that? And she presented a series of 24 sessions over 2022. And it was really amazing, the benefits that we saw from that, just in terms of employee productivity. And by the way, in terms of employee morale, it's measurable. I didn't measure it, but I can tell you it is measurable. And we get, out of 150 employees, we've had 60 or 70 people in those sessions. And the last one she did just a couple of weeks ago was, what's in the trainer's fridge?
Love it.
And
Love
she was
it.
talking about meal planning.
Yeah.
So, there's all kinds of things that you can do. And whether you use a trainer to do that, or if you're a business, maybe you have some ideas or can help them, give them suggestions on how they could roll that out to their employees beyond just the weight measurement.
Sure. First of all, there are just so many great examples of businesses that are doing this. But I'd say if you're on the fence and you haven't jumped in as a business owner or a HR representative or a wellness champion for your business, take that first step. Get involved. Register. We'll help you if you don't have resources to help get people registered. Members of our team will come. Our community health team has been so great. They have a sort of a script written where they'll say, we'll register you with just a generic password, and you can tell us or write down your highest weight and your email, and we'll register you. Within a day, you're going to get a link to set your own password, and then you can put your weight in what it is today. And then that launches your journey. So for people that are having trouble maybe figuring out, there's all sorts of ways to get involved. The business, I'm surprised coming out of COVID that there's not more participation in the Healthy Washington County Business Challenge, because Paul Fry and the Chamber have been huge proponents of this, both of our existing businesses and new businesses coming in. We're making connections to Martin's, to Volvo. We have a big challenge going on with Washington County Public Schools. We would really like to see more engagement from the city and the county. Mm-hmm. We know there are 1,500 potential employees between the two entities. And I think a missing piece of this is, like Mick Cornett, like, we're all in for this. Like, we'll do something special for our employees if you sign up for this. Because who wouldn't say that they want their employees to be healthier? I mean, it's those pennies invested up front are really going to pay dividends off for so much upside.
Lower healthcare costs for the company.
I have 5 employees, and I can't afford a wellness program or some of these largest wellness programs that I have some of my other companies that I work with. And I use this to supplement the healthcare that they do have to create a wellness program. So, it was something simple as changing the snacks out inside the office and saying, all right, we're taking away the cookies and we're going to put some fresh fruit. So we bring in fruit and healthier snacks there. And we have walk-in one-on-ones is optional. So instead of doing our sit down and going through our review process over a desk, let's take a walk together and have the same conversation as we walk. So those are the kind of things, and they have access to all these partner benefits as well that they can supplement their healthcare program with, and then have a wellness program that's built in at no cost to me as the employer. So those are some of the little things as a small organization you can do as well.
Absolutely.
So, I have been thinking through my mind all of the different components of this. Obviously, we've talked about access to healthcare, and it sounds like Meritus is continuing a journey to make that easier for our community. We've talked about collaborative partnerships and the business partnerships and the YMCAs of the world and the health department and those types of things. We've talked a little bit about the education piece. We've talked about opportunities for physical activity. What about access to healthy food? Specifically, and we talk about disparities, the unfortunate part is, from everything I've read, those on the lower end of the economic scale don't always have that access to healthy food.
Absolutely. It is a sad fact that in a county as rich with agricultural abundance as this county, that we still have food deserts, not just in the city, but in the county as well. So, again, not everybody has access or availability to get to fresh fruits, fresh vegetables. If they have access, they may not know how. They may not have had an example in their life of how to prepare those. So the Community Health Resources Commission and Horizon Goodwill applied for a grant through the CHRC to have a fresh foods grocery store, and they're building that on Prospect. You cannot trace in a mile radius from Prospect and find a place to buy fresh fruits and vegetables. And that isn't to say that you can't walk into a mini mart and get, snacks, but they're not healthier choices. It is easier if you're on a budget to eat poorly than to eat well. And that's a question we should be asking ourselves. We're exploring, looking with vendors of the farm, farm stands and the farm markets, to take some of their produce that maybe they aren't selling, but before it spoils, and provide that for access. That's an initiative that happens, and we want to try to expand on that. We're looking at partnering to deliver healthier meals. Sitting on the Commission on Aging, we have 700 seniors in this community that are on waiting list for services, in addition to those already being served with Meals on Wheels. Again, we have questions to ask ourselves: how can we do that? We have tremendous faith communities that are reaching out, but coordinating all of that is what I think this also attempts to do, to bring together those resources, so that if you aren't sure where to do that, and by the way, at the Prospect Street, the plan is to do cooking demos that we could come over from Meritus, from the nutritional team, and show people how to do things that aren't time consuming and how to eat better. So lots of work in that space.
And all that stuff is also on the, at risk at all times. Like
Sure.
Meals on Wheels and Micah Backpack and some of these programs and food drives, they were the first thing to shut down when COVID hit.
Yeah.
Because they're 100% almost volunteer organizations that go out, and volunteers that go out and give these food, and they're dependent on others being able to give and serve as well. And when something like that happens in our community, so many other people suffer.
Yes.
Yeah, excellent point. All right, gentlemen, let's take a break. Stay with us. We'll have more after the break. Welcome back to the show. We're still joined by Dr. Doug Spotts of Meritus Health. Doug, thank you for hanging in there with us, sharing all this great information. Jim, I'm going to take it to you for this last segment.
So, I'm a numbers guy. Talk to me about the numbers. Talk to me about the numbers locally. Talk to me about the numbers statewide and nationally.
Absolutely. Well, pre-pandemic, Washington County was somewhere in the 18 to 19 19th place out of the 24 counties in Maryland in terms of being more obese, more overweight, and more diabetic and pre-diabetic. That slipped to, by the way you look at the statistics, either 22 or 23 out of the 24 counties. So the pandemic did us no favors in terms of all of those risks. More than 68% of the population is considered overweight or obese, and there's different measures of this, but if your BMI, which sort of takes into effect your build, your height, as well as your weight, is greater than 26, that counts as overweight. All my life, I've struggled to try to be below 27. So, it looks different for different people, and while there are those who would maybe need to maintain their weight or gain some weight, 68% of us are not within that 3 to 5 pounds of our ideal body weight. And of course, that has downstream effects beyond diabetes. It has effects on hypertension, on heart disease, kidney disease, on strokes, on joint disease, on hip replacements, knee replacements, carrying that extra weight around.
So that 1 million pound goal is very doable.
It's very doable. It's been done. It was done in Oklahoma City, and it was done in 5 years by being all in. One of 2 members of Washington County are at risk for becoming diabetic. And that's really keeping pace with the national statistic of almost 50% of Americans are at risk. And that just continues to increase. So if you want to look at this time of tremendous disruption in the pandemic that we've just come out of, this is an epidemic that really could become our next pandemic, or is becoming our next pandemic. And we should tackle it with the same community spirit, the same coming together, the same sharing of resources for all of our citizens. I firmly feel that that is our mission and our calling, because we have to do better. And Maryland is somewhere in the mid-range, I think 27th out of the 50 states of being at risk. And we'd probably think that of Maryland as maybe being healthier than that, because of some of the ideas that we all believe in and that we talk about throughout this great state. But we're still not there. So we have work to do.
Why do we struggle so much being proactive to our health versus being reactive?
That would be probably a whole other show, Terrence. But I would say, as a family physician, we as a developed nation of the world, you can see the statistics. I just listened to a Harvard Business Review podcast this morning that we have 12 to 14% of our spend and our workforce devoted to primary care compared to, we'll say, Canada and Great Britain, which is much closer to 47 to 50%. So we know that primary care, promotion of going upstream, wellness and prevention has those dividends that are paid off in terms of lowering healthcare costs, lowering disease. It's not to say we don't need specialty care here. It's not to say that we don't have just the most tremendous technology and drive, but we should put that same effort and that same reimbursement into the upstream prevention that other developed countries are doing. We have work to do there too.
I remember when I met with my doctor, I said, my first statement to her was, I want to lose weight. And she said, well, I'm not into pills and I'm not into surgery, so let's talk about the other ways we can do this. And I said, I'm not either. I hired a trainer. She said, okay, let's talk about that. Talk to me about what questions these people should be asking their healthcare providers, or what questions they should be researching as they start their journey.
I think just first of all saying, what is your advice should be my first step. And I think all of us would say that the first steps are these small steps. And trying to do lifestyle modification. There's a whole body of medicine now, it's quite exciting, that actually shows that you can reverse disease like diabetes, or you can prevent it from developing from pre-diabetes into diabetes just by lifestyle modification, the things that we just spent this whole show talking about, right? So, but we also realize that there may be some other genetic predisposition for some people that despite all that best effort, need some extra help. And there are safer alternatives now than we ever had before. And so your primary care doctors, your endocrinology doctors, we have resources at Meritus for that. There are resources in the community if you need to take medicine to assist that can sort of tackle both things at the same time. And then we have a really comprehensive bariatric surgical program at Meritus. But that doesn't mean everybody's going right for surgery, and that's not the aim of the program. You have to go through a pretty rigorous and comprehensive screening for your mental health and behavioral health, your willingness to really take all the necessary steps for preparation for that, and then compliance with that regimen after you go through that surgery. And that includes nutritional assessments with a dietitian and a number of the teams. Matter of fact, our bariatric program folks didn't want to enter individually, but they enter as an aggregate group that Cheryl Freshour, who sits on our steering committee in the hospital, reports in on a monthly basis. So that's another thing that we're exploring to make this more accessible to people that maybe want to do it in aggregate and make that easier for them to enter it.
Like some of our churches and community centers as well can do this as a group.
We recently heard from one of the parish nurse groups, our parish nurse group, that said, well, we're not in the business in our house of worship of weight loss. Well, we're not in the business of just weight loss either. There are lots of other people in that space. We're in the business of giving prevention and wellness information, evidence-based protocols, things that you can do, free resources to make that journey. We are in the evidence of trying to promote community health and well-being, I think, at all of our houses of worship. And so that could be our common theme and rallying point around that. We're not telling you, like you said before, Jim, to use Noom or Weight Watchers over some other kind of thing. Do what you're doing that works for you, but give the community credit for it. Show what we can do together. And all of our businesses, organizations, houses of worship, and all entities should be all in on this.
And just one more time, it's not just about weight.
Absolutely.
It's also about emotional health. It's about building healthy relationships. It's about mental health. It's a holistic feel of going for bold and living a healthier life.
It's about getting adequate sleep. It's about getting adequate exercise. And if you're feeling anxious, when you feel anxious or worried about something, we're all going to nibble. I'm a nibbler. My biggest thing to overcome at night is, it might be healthy. It might be a healthy choice, but snacking on those nuts or cutting some cheese and crackers, right? Well, that adds up if you do that night after night after night. Instead, think, do I really need that? Maybe I go drink a glass of water slowly. Can I do a mindful activity to slow me down? Doctors are notorious for eating quickly. It comes from our training, running down the hallway to put out the next fire, right? So slowing down has really helped me on my own journey for weight loss, because my wife will say, my accountability partner will say, you just ate that whole meal and I'm still on my second bite. You need to slow down, right? So it's all sorts of those kinds of things that factor into our good health. All under those categories of do, eat, and believe. We increasingly look for more partner resources to add to that list, to refresh it, to update it. There are some video clips, some things. If you're starting out yoga, you don't have to be a yoga instructor or go to that personal trainer. You can just do some chair yoga or get up from that chair and do some stretching. That might be your first step. So there's lots of resources there.
Excellent.
Well, Dr. Spots, one of the things that we were challenged with in Leadership Maryland is that success is inward looking, right? But the goal of leadership is to move from success to significance. Well, my friend, you are well on your way to making that happen. So thank you for all you do for the community. For me personally, I just remember how excited you were when you were going to be the team doctor at the Ruth Ann Monroe Basketball League.
So
and
much
being,
fun.
Boots on the ground. So it's just not lip service. You're putting in the work, and you have been seen and active in the community, and that's all that we all could ask for, and it's a model for all of us to follow.
That's nice. I never feel like it's enough. I always want to give more, but it's not just predicated on me. It's great community partners, great team members throughout this really wonderful community, and we'll do it together. There's no doubt in my mind, and I look forward to coming back as often as you want me to give updates, to talk about other topics for wellness and prevention and ways that we can continue to amplify this effort.
How do you publish your results? How do you publish your progress?
So we actually have the sort of boards out in front of the hospital are constantly refreshed and updated. Every week I give a report to the senior team, and we have sort of an internal and external mechanism to do that, and it gets translated over onto the health department's website with where we are at with our community goals. So pretty much week by week you'll see the number of registrants, the number of pounds lost, and then when you do sign up, especially as an organization, we will send while you're doing it as an organization. Again, no names, no personal health information, but 47 of your employees, were active this month, and you, by the way, lost another 100 pounds for the community as an organization. So we try to do that accountability to all of our partners.
Excellent. Thank you again, Dr. Spots. Thank you. Well, that is all the time that we have for tonight. We hope that you'll like us on Facebook, follow us on Twitter, and send us your comments to feedback@theflipsidetv.com. That is feedback@theflipsidetv.com. But most importantly, join us again next week for another episode of